On May 5th, the National Association of Teachers of Singing, the American Choral Directors Association, Chorus America, the Barbershop Harmony Society, and the Performing Arts Medical Society hosted a 2.5-hour webinar. Among the presenters were Dr. Donald Milton, a leading researcher whose works focus on the interrelated areas of infectious bioaerosols, exhaled breath analysis, and development and application of innovative methods for respiratory epidemiology. Dr. Milton is professor of environmental health, University of Maryland School of Public Health, with a secondary appointment in the School of Medicine. Also there were otolaryngologist Dr. Lucinda Halstead, founder of and medical director of the Evelyn Trammell Institute for Voice and Swallowing at the Medical University of South Carolina. She's also president-elect of the Performing Arts Medicine Association. Also, Molly Quinlan Hayes, director of Arts Ready and the National Initiative of South Arts, and most recently served as deputy director of South Arts. And lastly, Tom Clarison, project director of Performing Arts Readiness, funded by the Andrew W. Mellon Foundation to help performing arts organizations protect their assets, sustain operations, and prepare for emergencies. Much of the information presented was disappointing to hear, but important. I have included screenshots of all the slides they presented and took notes on the presentation and discussions. First, they addressed the possibility that we will actually continue singing live in the fall. Could we sing with everyone masked? Their slide and their conclusion was just no. This slide shows Dr. Halstead, the laryngologist, dressed as she does when she's working with medically unsure singers. She's wearing a N95 mask, which is fit tested, meaning that they put her in an environment where there's a strong scent and she cannot smell it through the mask. And that she said that in ideal hospital settings, 3 to 5% of the patients that test negative really are positive, and that outside a hospital setting, in a clinical setting or in a drive-by kind of setting, the false negative rate is more like 15%. And she also said that 15% of doctors, even dressed this way, if they're in their mid to upper 60s, risk dying from the virus. Dr. Halstead said if everybody in the chorus had a mask, that would help, but it would be very difficult for us to sing. First of all, the mask would have to be fit tested or it's not worth it, which means that it's completely sealed. And she said if it were completely sealed, we would be rebreathing a lot of our own oxygen, which would at best give people a headache and at worst create severe health issues for many people in the chorus. In this slide, Dr. Halstead warns that a kerchief or a bandana or one of the blue face masks or any of the things that we're being recommended to go out wearing would do almost nothing to prevent the virus from spreading among singers, and we can't sing that way. It would have to be just with a tightly sealed N95 mask, or it's not worth even bothering for singers. While this slide mentions group singing and performances in her narration, Dr. Halstead made it clear that the possibilities here are really just for individual lessons and very small groups. Even for small singing ensembles to meet, she said, really it would require development of a vaccine or a treatment that was effective and readily available. But even then, she said we would probably need gloves and masks for a while. Also, in regard to small groups or individuals, Dr. Halstead said that not only would there have to be widespread testing, but that the rapid diagnostic test that some people are developing, she feels has far too many false negatives, more than 15% right now, so that they wouldn't be useful for group or choral singing. So what would we have to do before we can safely return to live rehearsals? Ideally, she said, we would need for everyone to accept a 15% risk of being infected. The other presenters recommended that we have an attorney and an insurance professional on our board to help us draft a policy and perhaps a waiver that everybody would need to sign that they accept this risk. And for HIPAA and privacy's sake, a non-chorus member would have to stop each person, each singer and Ben and Linda and everybody at the door and conduct a screening, which would include taking their temperature, taking their blood oxygen levels, and asking them questions about where they've been, and also have proof that they've had a home test within the past 24 hours. Anybody who didn't want to provide that information would have to be turned away at the door. These screenings at the door that she mentioned in the last slide would have to be done every single week, ideally. If it's not ideal, the next best would be a high-risk situation in which they would still have to be every single day. They would have to be screening by a non-chorus member at the door before every single rehearsal. Everybody would have to accept the risk in writing. Everybody would have to have symptom screenings. Everybody would need to have their temperature and blood oxygen done. But the step down from the ideal would that we wouldn't demand a negative test within the past 24 hours. Then the presenters went on to discuss how to protect our audiences when and if we're finally able to have a concert. And they said that according to a recent study, as things stand now, only 1 in 7 would feel comfortable attending a live performance. Whereas over 50% might feel comfortable soon going to a park or a zoo or a stadium, this graph shows that only 34% would even consider attending a live performance. This slide says that even with a vaccine that worked, 80% would be willing to attend the theater or a concert again, not 100%, 80%, and that's with a vaccine. So to review, here were their conclusions and recommendations. They said there's no safe way to sing together as things stand now, and that rehearsal and performance venues both would need to have superior filtered ventilation and air exchange systems that we could verify, along with plenty of UV or natural light in order for us to be safe singing. So why wouldn't a mask work or nothing? They said basically singers access air from deep within their lungs, which pulls up more droplets than breathing or speaking or even shouting would do. And that singers breathe through their mouths when they're singing, so they swallow larger particles of droplets that wouldn't get past the filter of their nose, and it would go straight into singers' lungs. So in other words, if you can breathe well enough to sing, you're breathing in the virus. If we wear the masks that are filtered, we won't be able to breathe well enough to sing. So when can we go back? Really only if there's an effective vaccine or an effective treatment, and that's it. To have a safe concert, this is what we would need. Every singer and every audience member would have to be temperature checked and blood oxygen tested before they came in. So there have to be a line outside waiting to come in. Every single person would have to have temperature check, blood oxygen check before they were allowed in, and the audience would need to know this in advance. And the venue would have to have separate entrances and exits so people aren't walking toward each other. And hand sanitizer would have to be readily available to everybody. Masks would have to be readily available to all the audience members. No one would be able to share a program, and the guests would have to sit at least 6 feet apart. The panelists had other questions, such as should we restrict our audience to only those over age 10 or over age 18, since there's now a question about whether young kids can get the virus and it'll be very dangerous for them. Should we restrict the audience only to people under 60 or 65 for the same reason, to protect the vulnerable people? Should we require that every audience member be a mask or not be allowed to be seated? If there's an adjoining state New Jersey or Connecticut that's got a higher COVID rate? Should we prevent audience members from those states from attending? And what about the bathrooms and the restrooms? What do we keep them safe with? How should we maybe shorten the concert so that people don't need the restroom? Or but that would include the singers as well. Should we forego refreshments? Should we require that people pay in advance? Or would we be allowed, would we accept checks but not cash? How would we handle the money? At rehearsals and concerts, we want to keep our audience safe, but we want to keep our singers safe as well. So the best practice should be that we require proof of testing, negative results within 24 hours of the rehearsal, as well as temperature checks at the door. The floors should be marked off in 6-foot squares so that nobody stands too close. Gloves and masks and sanitizer should be available for everybody. No one should be allowed to share music. And they recommend that we be very reluctant about accepting a gig that requires us to be in a particular place at a particular time. They said that everybody should be notified and agree in writing that there's at least a 15% chance under these conditions that you could get the virus. Otherwise, we ought to just not return to singing live together until the risk is substantially lower. So they asked some of the same questions that had been asked before, but one of the questions they asked that I thought was very interesting is if a certain percentage of singers don't feel safe, should we go forward, and what would that percentage be? If 10% of the singers don't feel safe, should we have rehearsals anyway? If 50% don't feel safe, should we have rehearsals anyway? An interesting question. Of course, while I was watching, I had my own questions like, how many people would need to pay dues for Kohl-Reinach to be economically viable? Because we would have fixed costs of conductor and accompanist. So how many people would need to pay dues? And what would the due structure need to be so that we're making up for people who wouldn't be willing to pay dues or wouldn't be willing to come back? And because we're a Jewish chorus, how do we make sure that we are honoring our highest values, which is saving a life, and that should be the highest priority. One of the things they recommended is that as we consider going back to live rehearsals, that all communication go to and from one designated person, which they said doesn't have to be the president or chorus master or anybody, but one person is receiving information like complaints about people who are not complying, about standing too close, and that same person should be disseminating information to the group so that people are not hearing conflicting things. And that we ought to develop a plan in coordination with the county health department. They also had questions such as, what if key people get the virus and are out for a month? How would we continue? What would be our plan if the performance venue or the rehearsal venue is infected and becomes unavailable for a month or so? What would we do if we're in charge of disinfection? How would we go about that? Or how do we make sure that the ventilation system is what we need it to be before we go back? Lastly, they reviewed what we can be doing now while we're not rehearsing or performing live. And I was happy to see that we're doing most of these things. They said that we should encourage people to rehearse at home, and we should use technology like Zoom to keep people rehearsing and to keep people together. They wanted to remind us that it's a marathon and not a sprint, and that we should work toward excellence. If the experience in rehearsing isn't excellent, they suggest that we just don't do it, because doing it halfway or in a compromised way, they felt would turn off more people than keep people looking forward to coming back. They suggest that we keep in touch with the audience by using currently recorded music that we already have in the can, which we've been doing. They suggested that we ask for donations, which we've been doing. And they mostly said, don't rush back. It's better to live to fight another day. Don't take risks. Because if somebody in the chorus gets very sick or somebody in an audience gets very sick, people will be reluctant to come back even when it's safe to do so. And that were their suggestions about what we should be doing now. Thank you.